at ACC 16. We are in Chicago. One of the great fun things about covering this particular meeting is we get to put highlights of the meeting in an actual supplement to the publication. So you get CardioSource World News as you always do, plus you get a supplement with all the coverage here. Same goes for CardioSource World News Interventions, where we do a lot of material for this meeting. So what I would like to do right now is introduce you to Michael Crichton, who is the Vice President and Head of Cardiovascular Business Unit at AstraZeneca. And what's new for you at ACC 16? Because there's some really good stuff happening here.
Rick, it's great to be at one of the premier cardiology events in the world. And so it's nice to be here and speak to you about all the exciting things that we're doing. Three things are really important for us here at ACC. First of all, exciting new guidelines on oral antiplatelet therapy, wherein patients who have just had an acute MI, a heart attack, Brilinta is preferred over clopidogrel, Brilinta being an AstraZeneca product. In post-MI and prior patients who have been in MI, Brilinta's now got a very clear place in terms of dual antiplatelet therapy extended out past 12 months. So this is important because now patients who have had an ACS, who have had a heart attack, now can have really good guidelines to support that use in the community. So we're very excited about that.
I mean, those guidelines were released right before this meeting. I think it was like the 30th of March. So those are absolutely new. What do they tell us?
Important guidelines because they tell us if you've had an acute MI, if you've had a heart attack, ticagrelor is preferred over clopidogrel. So very, very clear place, and that's in STEMI, non-STEMI, or UA patients. So that's really important. And also, if you're a patient and you're out past 12 months, your dual antiplatelet therapy needs to be there. Ticagrelor is the only product that has that exclusively in the label. So that's important for ticagrelor and where we are. The second thing that's really important for us being here is our commitment to cardiovascular outcomes and health. And we've actually got some new data out on the PEGASUS trial in some subgroup analysis that was very important.
Some important subgroup analysis too. Now, first off, just overall, remind us of PEGASUS-TIMI 54, the original data.
Yeah, happy to. So this looked at a trial of ticagrelor plus aspirin versus aspirin in patients who had been out 1 year prior MI. So important data that we didn't previously have, and it showed that ticagrelor plus aspirin was better than aspirin. And this is important for patients because we know that in the Plato trial, we demonstrated superiority versus clopidogrel. So having this data now is a really nice complement that long-term patients need to be treated for their atherothrombotic disease with good dual antiplatelet therapy.
So now what are you adding to the information?
Well, now what we're adding is we've seen important subgroup analysis, whether it be with diabetic patients or with patients who have had PAD, and that just really reinforces the primary endpoint.
Both high-risk settings.
Absolutely, and so important questions to answer for patients, and really going after tough unmet need and scientific questions that are supportive of the overall trial in PEGASUS. Other thing, Rick, we're really excited about is the third thing is around what we're doing as a franchise and the commitment to cardiovascular. In particular, we have ZS9 here, ZS Pharma, which will soon bring a future product for hyperkalemia. And we're excited about that because hyperkalemia is an unmet need, and it's something that I think is very important in terms of cardiovascular outcomes and something that we're working very hard towards.
So describe the product a little bit.
Well, so product's not available yet.
Right.
Okay, so it's before we actually have an indication. So I'd want to make sure I'm very careful about what I'm sharing at this point.
What's it supposed to do? I mean, what's the mechanism?
Yeah, so it's an ion exchange. So it works in the gut, and we're really now just building out the filing for the FDA, and we're really excited about what that might mean for patients. This is an area that a lot of cardiologists are talking about very favorably in terms of controlling hyperkalemia.
I mean, there's a great paper that we have coming out that talks about the microbiota of the gut and how it's important. And this just may be some more of the same in terms of we really need to think about something beyond the heart in terms of health.
Well, it's interesting, right? Because I think, as you're pointing out, whether it's diabetes or chronic kidney disease, these all have serious implications for cardiovascular outcomes. And that's what's great about AstraZeneca following the science, is we're really committed to what are all these factors and disease areas that actually do affect cardiovascular outcomes.
Because in the case of this paper, the microbiota is being affected, and it is affecting heart failure.
Yeah.
It's like, Who'd have thought for that one?
Exactly. Yeah. Yeah. Incredible amount of research and new information being shared here at ACC.
It's terrific, and I thank you very much for your time. We have a variety of things that are being promoted around the meeting. Please check out CardioSource World News and CardioSource World News Interventions, where I am Executive Editor Rick McGuire.